My name is Roy Barnes, and I'm now a country lawyer, practicing law, but for years I was in public service in Georgia, 22 years in the General Assembly and 4 years as governor. You know, men are haphazard in their health care. We generally don't go to the doctor until it's too late. And particularly, we know from public policy that preventative health is the cheapest and it has the best results, because if you're in a preventative mode and you're educated about it, you will go to the doctor sooner. And that was the whole purpose of what we're trying to do. And in Georgia and in the South, and I'm sure throughout the country, there's a disproportionate effect on African American men than there are on any other group. And part of it is because of lack of access to health care. But a lot of it is just because of lack of knowledge. And that was what we intended to concentrate on and did when the Commission on Men's Health was formed. Remarkably, the chair of the Health and Human Services Committee, Buddy Childers, he was from Rome, Georgia. He's still alive, but he had prostate cancer about the same time. And when I decided to do this, I called Buddy down to talk with me, and he was very enthusiastic about it because he said, I never knew anything about, being checked for PSA or anything else. And he said, if you want to put it out there, I'll help you with it. And he became one of my big proponents in the General Assembly, and it was well received at the time. In public policy, it's always 2 steps forward and 1 step backwards. And so it's a slow process. The main thing that we did was on education. We had printed men's health issues. I think we distributed between 80 and 100,000. We created a lecture series where we went around. We had a men's health day and all of that. Yes, the gap still exists. I attribute that to 2 things. One is that, again, lack of access to health care. A lack of primary care physicians is included in that. And unfortunately, there's just not been the continuing focus on what is a health crisis, really. And now it has become very unpopular to talk about inequality. But to talk about the inequality of health care availability and the health care gaps that exist between women, all women, and men, but in men, particularly on African American men. The most strategic first steps were there's influence, is to contact and create a network of influence makers. Now, that existed in the medical community, particularly primary care physicians, who are on the front line of this. And one of the things that we tried to do was create a consensus of those primary care physicians, which we had no dissenters. And we tried to assist them with materials that were easily readable and understandable by their patients rather than being lost in the medical jargon and acronyms that nobody understands unless they had some medical training. So I think that was important, to create an overall network among the primary care physicians. The second thing that I think was important was just not to depend on, we'll write this and send it out and just expect everybody to do it. So we had a public education effort that included some PSAs that we had, and then also speakers from our department. I created the Department of Community Health, and to help with disseminating with speakers and civic groups at everything, and medical groups, that this information was available and that we should disseminate it so that it had the broadest focus. First, anytime you tell an insurance company that they have to cover something, they're automatically opposed to it. And I finally just shamed the insurance companies. They had all signed off a few years before on mammograms. And I said to not allow prostate exams, for example, to be covered with that is hypocritical and wrong. And I used pure political persuasion on that. The other issues, there was not pushback. I did have some that says, well, I created an Office of Women's Health also, so that it would be balanced. But also, the greatest thing that I tried to push through all of that was regular examinations. And that's the reason I wanted to include the cost in health insurance of prostate exams, because I figured if they ever got in there, the doctor was just not going to look at that. He was going to do an overall examination. Now compare that with women, for example. Most all women are on a regular schedule of doing mammograms, pap smears, and other things like that. That's unheard of for men. And the whole idea was to try to replicate what was happening in the preventative care of women over into men. It was new, where nobody disagreed with it. It's just that they would blow me off and, say, well, man, all that stuff. And it took an effort with the General Assembly, and Buddy Childers was very helpful giving testimony about that and speaking about it. Prostate cancer moved folks. And after they heard that prostate cancer was highly curable, I've had prostate cancer, but it is absolutely necessary that you have annual examinations and have PSAs and other things like that. That was the most helpful message I had. And what I would do is tell them, well, just like prostate cancer and PSA checks and things like this, pulmonary issues, and particular cardiac issues. If called early, you had a much greater chance of living or not requiring surgery. And that became the winning strategy. I guess it's a little bit of scaring them. You're going to die if you get this disease, because it's going to be metastasized in prostate cancer. Or you're going to have such an occlusion cardiac-wise, or you're going to have lungs that cannot be repaired or helped in any way. So I hate to say that, but fear was a good message and memory, and it works. I mean, there's 2 or 3 things there. One is we have made some tremendous health. Gene editing, biomarkers, nanotechnologies. I mean, men have a high percentage of colon cancer also. And now that there's a strong congenital connection with colon cancer. And so with all of those, what it does is that it gives the tools to inform men. It's even better now than it was 20 years ago, 25 years ago. The problem that we have is that governments have lost, to a large extent, some of this is funding, they've lost their concern about preventative medicine everywhere. And that has had a greater effect on men. Local and state governments particularly need to have a focus, as we did 25 years ago. In the state of Georgia, they've done away with the Men's Health Commission, and that's wrong-headed. And so the way you move and change that is through the political process. But you have to know enough about it to be able to convince your legislators or the governor about it. And so what the Men's Health Network can do is educate and encourage to make sure that these things that we can change that save lives are known to the general public, that they follow the preventative methods, and that they encourage their governments, whether it be local or state, to participate in that education effort and disseminate the information that will save their lives.